Hello, hopefully all of you can hear me out there. It says that my live video is starting. All right, hello everybody. This is Dr. Ann Auburn at the Natural Health Improvement Center. Welcome to my presentation tonight. I'll try to keep this to an hour. I can't promise though, but I'll do the best I can. I'm going to have some notes. I may be looking over to one side or down in my lap to access my notes. But otherwise, I am here with you to tell you all about what we do for pain here at the Natural Health Improvement Center. So we have a lot of modalities that we use on a regular basis here, and I'm going to try to go through some of those tonight. We're going to talk a little bit about what pain is and the different angles we come at pain to make it better. So as you all know, pain has many faces. It could be neck pain, it could be headaches, it could be related to hormones, it could be from an injury, it can be from a chronic autoimmune disease, it can be coming from your gut. You know, I've had people ask me a lot of times, like, what's the connection between the gut and pain? And there is a big connection because your gut is the most huge surface of absorption in your body. That's where you get your nutrients. That's your first defense to any foreign invaders. And if there is something coming into the body that is causing inflammation, that inflammation can go from the gut and into all those lymphatics that line the gut, that supply the vessels that supply nutrition to other parts of the body. And if those toxins or inflammatory mediators get there, they can go anywhere, and it can go to your weak spot. If you're a sinus person, it can go to your sinuses. If you have arthritis in your hands, it can go to your hands. If you have a bad back, it can go there. So we really do look at all of these different places where pain can be coming from, or a pain that you already have for some reason, like bad arthritis or whatnot, can be exacerbated. And that can be your diet. You know, we do food allergies here. We call them IgG food sensitivities. And I've lost count of the hundreds of people over the last 25 years that I've given them their test results, and they go off gluten or dairy or some other food that they thought was not giving them a problem, and voila, they don't feel like they have arthritis anymore, or they don't feel like they have chronic headaches anymore, or their gut is feeling better. So just so you know, it's all connected, and that's what we're thinking here at the NHIC, because we practice integrative medicine. That's why we call it integrative medicine. We're integrating everything together. So these are my objectives for tonight. I'm going to try to tell you what is pain, and try to tell you about our multidisciplinary approach. And I want to tell you a lot about ligament and tendon laxity, because we do a lot of treatment of ligament and tendon laxity with prolotherapy and PRP, regenerative injections. We also talk to people a lot about neuromuscular imbalances, and we use a lot of our local physical therapists to help us with that. They are fantastic at doing that. And we also have some really interesting injections besides the prolotherapy and the PRP that you may not know that we do. And we also do some really cool stuff, hyperbaric oxygen therapy. I'm going to tell you why that works, and there's some really impressive research that is out there. I'll review a couple of those quickly, and then I'll talk to you about Prolozone. Some of you may have heard about Prolozone. It's where you combine prolotherapy and ozone. I'm going to describe all this stuff, and then we'll just talk about some of the other things we do here that help pain. So commonly reported pain conditions, back pain, headache, migraine, neck pain, and low back pain are the common ones. Facial ache or pain would kind of fall in the headache category, but it's a leading cause of disability in adults under 45 years of age. And more than 26 million Americans between the ages of 20 and 64 are experiencing frequent back pain. So this is really common, especially in a practice like a general practice like mine, a family practice. We're kind of the first people that see people in pain, but we also love dealing with musculoskeletal issues, and we love helping people, so we have lots of tools for that. And so what is pain? Pain is a signal. It's a message to your brain, to your nervous system saying, hey, something's not right here. there's something, some pain generator that's happening. Now that could be bone spurs, from arthritis, possibly, or it could be a nerve is being pinched a little bit from a tight muscle, or from the bottom of your spine, the bottom of your spine, the sacrum being turned a little bit. That can definitely act like sciatica, and it's actually not true sciatica. Like, it's not, pressing on the nerve, or the nerve's not damaged, but there is some pressure on the nerve, and we can relieve that oftentimes with an adjustment. I'm an osteopath, so I do osteopathic manipulation. There's only one of me, and so I can't do that on everybody, so I send people to other practitioners of osteopathic manipulation or chiropractors in the area that are very good, or our physical therapy friends. So, but it is a signal that something is going on. There might be some injury about to occur. Now, chronic pain is a little bit different. Chronic pain is like the ongoing trauma is no longer there, but there is inflammation that's left or tight muscles that are left. There's still that signal that's coming through. Now, sometimes the generator of the pain is still there. If it's coming from arthritis and there's inflammation in those joints, or there's bone spurs, yes, that's a continuing cause of the pain. But even when you have that, there's a lot that you can do with the surrounding soft tissues, the muscles, the ligaments, the tendons, the fascia, all of the connective tissue that kind of keeps our body together. And that's everywhere in our body. It's in our torso, it's in our cranium, it's in our hands, our arms, our legs, our hips, our pelvis. It's everywhere. And so, we can work with that. So we have to look for these other things that might be causing the pain, as I spoke about earlier. One of the main things that can be causing this is ligament and tendon laxity. And I'll describe that a little bit more later, but also a body out of balance, neuromuscular imbalance. And that's one of the things that I'm very particular about with my physical therapy friends, is they have to be really good at sorting out neuromuscular imbalances. I only send people to the people I know that are very good at sorting that out for each individual, not just giving them the general back program, but talking to them about what they do, how they use their body, and educating them, like what muscles are too tight, what muscles are too lax, what signals are not getting to the different body parts to keep us in symmetry front to back, side to side. Chronic pain needs to be addressed looking at from all these different angles, not just looking at, oh, geez, your low back hurts. Well, there might be something in your low back. Well, what if there's something in your legs? What if you have a short leg? What if you have, some kind of a pubic bone asymmetry? What if the muscles that attach to your pubic bone, they're tight on one side and weak on the other side? Or what if your abdominal muscles aren't working? All of this can give you low back pain. So, it's never an isolated thing. And then that can be compounded by lack of hormones, or poor thyroid function, or a poor diet, or inflammatory processed foods, things like that, or food allergies. So we look at all that. So when you look at pain, here's a picture of an iceberg here. It's very hard for you to see it in the reflection, but there's the tip of the iceberg over the top of the water. And that's, many times, what is addressed is that, pain that's like, ooh, it's killing me, doctor, give me some pain medication. You could use heat, you can use ice, you can use pain meds, you can get shots. But is that really addressing the other 80% of the iceberg that's below the surface? Maybe not. So when you do have pain, think, okay, what is the root cause? What happened? Why is that? So we want to get to those root causes and fix the problem. And many times, this is a picture of an onion. I know you can't see it very well there, but an onion, has rings. And, we just think of, when we're trying to handle chronic pain, we're trying to peel the layers of the onion. And, whether that be, the way you move, your posture, how you sit. I know I can get neck problems when I talk a lot and I give lectures and whatnot. If I'm sticking my neck out a lot, I can actually strain my neck muscles, and then I have, muscle imbalances, and that gives me pain and headaches and things like that. So I'm very careful with my posture. I do stretches. I'm aware that that's an issue with me. And, I take my hormones every day because the hormones definitely reduce inflammation and make me more comfortable in my body, and I can sleep better and all kinds of things. So we need to look at all those different layers, and that's what we do here in the integrative medicine that we do here at the Natural Health Improvement System, or Natural Health Improvement Center. Underlying factors could be ligament laxity, neuromuscular imbalances we talked about. Also, sleep disturbance. Are you sleeping well? Do you have, problems with your teeth? Are you grinding your teeth at night or during the day when you're working and you're trying to get things done and you're under pressure, things like that? Have you gained weight? That's another thing that can cause us to hang on to lots of toxins. The fat tissue holds over 250 different toxins, which can be inflammatory mediators. Do we have mineral deficiencies? Do you not have enough magnesium? These are all things that we can check, usually with some kind of a test. A lot of times we'll do a hair analysis to see if we have low minerals in our hair. Do we have signs of malabsorption and maldigestion? This can be a real source of pain, because then you're not getting the things you need to heal and repair your tissues. An obvious example would be celiac disease, where people have a problem with gluten that damages their small intestine, and it can get so bad that it can start affecting muscles like the heart and the brain and that sort of thing. And people can have terrible weight loss, but you can have maldigestion and malabsorption even if it's not celiac disease. Another one would be bowel dysbiosis. If you have bowels that are unbalanced, you don't have enough of the good bacteria, too many of the bad bacteria, that sort of thing. Another one is stress. Stress is a huge instigator of inflammation in the body. That's why we do cortisol tests in our practice. And also toxins like heavy metals, lead, mercury, aluminum, cadmium. These things are common. Also, candida overgrowth. Maybe some of you have had that treated here before. Certain people tend to have a tendency to overgrow candida easily, so we treat that with diet and supplements and probiotics and things like that. All of these can be investigated. So we kind of meet with the patient, do an exam, figure out where they're at with their health, make some suggestions, talk about testing, and then we work with the patient. We figure it's like a team approach here, and so we're not going to make you do everything all at once. That would be impossible for most people to do and very confusing. So we just take things, one or two or three things at a time, and handle what you can handle, and we're building health over time, and building that health reduces inflammation. We have a lot of modalities here. As I mentioned earlier, I do osteopathic manipulative treatment. Sometimes I send people out for that because I don't have enough room in my schedule. We do trigger point injections. That's something that you may not know that we do here, because we talk about prolotherapy and PRP a lot, and I'll describe what those are shortly. And those are fantastic for stimulating healing and true repair. But sometimes you do just need something to calm down the pain. We can take 5% dextrose and just inject it right under the skin, and it blocks these little, what are called peptidergic nerves. That's a long one, but peptidergic nerves control some of the pain that is in an area, and it controls inflammation and other functions in the tissues underneath. So we can block those with just 5% dextrose, inject it in. We can do other trigger point injections that are like anesthetic type with maybe a little bit of B12s. Sometimes we might use steroids. We don't want to use a lot of steroids, but sometimes that's necessary for a bad tendonitis or something like that, to get the inflammation out, get it under control, and then we can do some more reparative stuff later. So those are some of the things we do. Sometimes we send people for medical massage. Dr. Flynn is our fantastic holistic healer, acupuncturist, and oriental medicine doctor. Dr. Flynn has really helped me a lot with many cases. He's here a couple days a week helping our patients. And then we have hyperbaric oxygen therapy. We'll be talking about that later. We have our Hocket ozone sauna, which is also a far infrared sauna. we have specialized therapies, like maybe you didn't know that vitamin C, 25 grams, is a very strong anti-inflammatory. Some people use that as an anti-inflammatory. We also have our lower dose vitamin C IV treatments, the Gabby IV push, about 2.5 grams, and then our Myers cocktail is about 3.5 grams of vitamin C. And then there's B vitamins and calcium and magnesium in there that all helps with healing and repair on many levels. We also talk a lot about weight loss here, getting to your ideal weight, maintaining a healthy lifestyle, having, a livable lifestyle where you can have those controlled cheats. We're kind of experts in that area. We know how to help people with that. And there's lots of different ways for people. Everybody has to find their best way to, keep that in, what works for them. And then, of course, all the hormonal, thyroid, gut issues, we have all those tools as well. Okay, now let's talk a little bit about ligament and tendon laxity. So this was a concept that was sort of defined by a couple of doctors, but George Hackett was the one that wrote the first book on this. He was a surgeon, and he noticed that a lot of people coming in that had what he called a Pratt fall. That's a fall back onto your butt or your low back. They had this chronic pain, and he finally figured out that the source of the pain was ligament laxity. And later on I'll show you a picture of the ligaments that are in your sacroiliac joint and in your low back. And when you see how many ligaments are there, you'll realize that if these get disrupted and if they get weak, things aren't going to stay together as well. And then what happens after that is those fibers, those ligament fibers, when they're stretched, they are painful at a lower stretch than they could previously handle. So if they get stretched out, they don't really go back to their normal tensile strength. They will heal a little bit, but they never heal completely. And so the way that George Hackett described it was ligament and tendon relaxation is a condition in which the strength of the ligament fibers has become impaired so that a stretching of the fibrous strands occurs when the ligament is submitted to normal or less than normal tension. So what he's saying there is, that normal or less than normal tension can cause discomfort. And there are specific pain patterns for these, and I'll show you those in a minute. So ligament and tendon laxity leads to neuromuscular imbalances. So what happens when your ligaments don't keep things together? Remember, ligaments go bone to bone, and tendons go muscle to bone. So with that combination of things, it's meant to keep the joint stable. When that stability is lost and it's more lax, what will happen is the muscles in the surrounding area will start working harder to try and keep those joints in place and try to keep you stable as you're walking, talking, using your arms and legs to do things. And because the muscles are being overworked, certain groups of muscles get too tight, other muscles get inhibited, and then you have neuromuscular imbalance. So it just basically creates an asymmetry in the body, and then those muscles that are working so hard, they get fatigued. And a lot of times this is the source of the back pain, is the overworked muscles, which is secondary to the ligament and tendon laxity. See how these layers are stacking up here? Now this is where physical therapy is super helpful. My physical therapy friends have helped us tremendously. Like, I can give you a few stretches and exercises and things like that. I know a bit about neuromuscular imbalance. I've studied it. But when you have a physical therapist that really knows this, and they're working with you one-on-one, and they're watching you walk, and they're seeing how you respond to treatments and exercises and stretches, they're really figuring it out down to the muscle. And so we love having people work with our PT friends and figure that out. So in addition, physical therapy is, there's tons of reasons to do it. It improves mood, it improves strength, it improves your cardiovascular status, it improves your motor control, it improves the neuromuscular imbalances, as we've been talking about, and decreases pain usually. It gives you a lot of tools that you can use at home. I mean, that's the whole idea. When you get done with physical therapy, you should have a program that you can do at home. And then, of course, you can always go back if you need help. Nowadays, physical therapy, you can go and just go on your own. Although if you want your insurance to pay for it, usually you need a prescription. So that's when we kind of have our talk with you and examine you, decide if anything else needs to be checked, make sure the pain's not coming from something else bad, and then we send you over there if we think it's appropriate. And then PT does help you maintain your gains, and it makes our injections, whether we're doing prolotherapy or PRP or whatever, work better. So I wanted to show you. I'm sorry, I don't think you can see this that well. I just can't get that picture in there for you. Sorry about that. Oh, there we go. Basically, what this diagram is showing here is that when you have pain in your neck, those pain patterns can go, if it's upper cervical, they can literally go up over your head. And it's coming from ligaments back here. These are ligament pain patterns. And if it's kind of in the middle to lower neck, like in this area, that can go right down your arm and into your hands, even into your fingers. You can think, oh my gosh, I have a pinched nerve. And, possibly that's true, but oftentimes if it's not like a lancinating, burning, tingling pain down the arm, that achy pain is probably not from a nerve being pinched. It's from neuromuscular imbalances and the ligaments that are lax, that are not holding things together. So these are ligament referral pain patterns, and they look so much like nerve pain problems that people get them confused. Also for the lower extremities, again, you can't see this one very well, but it shows that in your low back, in the small of your low back, you've got your sacroiliac ligaments and your spinal ligaments. And when those are lax, it goes right down your leg like as if you had sciatica. It can go on the inner thigh. It can go down to the bottom of the toes. It can go down the back of the calf. It can go down the back of the thigh or the side of the thigh. And it seems like, oh my gosh, I have sciatica. And it's the nerve, it's his nerve pain. And a lot of times it's not. It's ligament laxity. So, again, somebody who's trained in this, who can go through all of your symptoms, get your history, do a good exam, we can kind of determine if it seems like it's truly nerve pain or if it's ligament laxity. So the definition of prolotherapy is the rehabilitation of an incompetent structure such as a ligament or tendon by the induced proliferation of new cells. So when we do these injections, the injections into the area are to stimulate the body to repair ligaments and tendons and bring back the normal tensile strength. So let's see. So that is prolotherapy. That prolo means proliferation. Therapy means something we do, and that's we're rehabilitating these incompetent structures. Now, what is PRP? PRP really is a type of prolotherapy, but it's done with a different solution, which is platelet-rich plasma. Platelet-rich plasma is where we take your blood out. We do like a blood draw, just like as if you were getting your blood drawn for, getting your blood counts or your hormone levels. We take that blood and we put it in a special centrifuge. And this centrifuge spins it fast, slow for about 15 minutes. And then when you take it out, the red blood cells are at the bottom. I'll show you a picture of that. And the yellow platelet-rich plasma is at the top. Now we have a special machine called a Medifuge, and that Medifuge also, because of the way it spins, it kicks out more of what we call CD34 cells, which is a certain type of growth factor. There's about 10 to 15 growth factors in there, but those CD34 cells are like gold. And what we do is we actually scrape them off with a sterile needle. We scrape them off the side of the tube so that we suck them up out of there and make them part of the platelet-rich plasma, which we inject into the patient. This is all done under sterile conditions. It's all clean. It's all your blood, etc. It's pretty amazing that we can take something from your body and then make it into a platelet concentrate with these growth factors, inject it back into you. And I'll show you some amazing pictures. I hope you can see them later. The reflection here may not allow you to do that, but they're really cool. And by the way, you can get a copy of my entire PowerPoint. It would look like this. It's kind of like black and white. but we'd be glad to send that to you if you'd like that. Just call the office, 616-301-0808. Just talk to anybody, leave a message, they can call you back, and we can get this to you. Anyways, so PRP is a special type of regenerative injection that's using your own blood, your platelet-rich plasma. This was historically used in cardiac surgery. The first was Dr. Ferrari in 1987, and then it's been used in maxillofacial, plastic surgery, spinal surgery, orthopedic surgery, dental. When I had an implant put in, they put PRP in there so that it would heal better. Podiatric medicine, there's a lot of scientific papers of podiatrists using this for foot pain. And just general wound healing, they've used it for burn patients and things like that. So PRP basically was kind of something that came about from people who do prolotherapy. And they realized, okay, wow, this is healing in all these other fields. Wow, how about if we use this for musculoskeletal? So these practitioners previously trained in prolotherapy started using PRP and noticed, wow, this works better. And in my hands, and basically I teach prolotherapy and PRP for a group, and you know, our consensus is that it's probably about 3 times as potent as the prolotherapy. It's a little bit more expensive, but in the long run, I think most people save money because they're having to do less treatments overall. And okay, the question is, you're probably wondering, why does prolotherapy and PRP even work? Well, it's all about blood flow, and it's about regenerating this process of healing. Remember I said earlier, like when you get a ligament damaged or stretched out, it will heal a little bit, but it never goes back to its normal tensile strength that it was before that injury. And this is what we find a lot. People had a car accident, or they fell off a bike, or they strained their back somehow. And just after that, things just were never the same, no matter how many adjustments they get, no matter, you know, what practitioner they went to, what injections they had, it just didn't totally go back to normal. Well, this is the way to stimulate the body to say, hey, body, you forgot. Hey, you didn't finish your healing job down here in the lumbar spine or the knee or wherever. Is a reminder to the body. So we inject these solutions. It creates a little bit of inflammation, and then the body's like, oh yeah, I have to send more blood flow down there. And then in response to that inflammatory response, and with PRP, the growth factors that we're sending down there, the regeneration is restarted. Fibroblasts, macrophages, all these different factors that are the precursors to the tissue that's created there. This goes to the area where you do the injections, and it helps to heal it. Now there's a process, you know, like with prolotherapy, it's probably 5 or 6 weeks that's working, and I actually did some research on that, and 2 people that had low back pain had never had prolo before, and we measured it on an ultrasound. And you could see that those ligaments were thicker in the low back. And it did stop right between 5 and 6 weeks. And then in animal studies, they've shown that too. Now with the PRP, I've never done any research on that, but just anecdotally from treating patients with this therapy for many years, it seems like, and even in myself, when I got it done in my knee where I have a slight meniscal tear from an old skiing injury, it seemed like it was like 2.5 to 3 months. It was still getting better and still getting better. So this shows you basically what it looks like. Like, here is our platelet-rich plasma. The top of this, there you can see it with me blocking the light a little bit. See, it's yellow at the top. That is the platelet-rich plasma. And then along the sides of the tube there, you can't see it in this picture, but there are the CD34 cells. We can see it, and we scrape those off. And this is just a picture of the centrifuge. This is the Medifuse centrifuge. These are, we put in, you know, either blanks or we put in vials filled with blood, so we can do several at once. Of course, we label them so we know it's yours. We're usually only doing 1 person at a time, but sometimes there's 2. Then this is spun, and then when the machine's done, we take the platelet-rich plasma out. So activated platelets are going to release these growth factors, and this is an actual electron microscope picture, microscopic picture of these cells, these platelets releasing their growth factors into the tissue. And this will stimulate stem cells and other things to come to the area to heal it. It's really powerful. I have a whole lecture for doctors where I go through each and every growth factor and what it does, and it's pretty amazing. So the role of platelet growth factors, well, what do? They're proteins, and they signal things. So they tell the cell, proliferate, differentiate, regenerate tissue, heal a wound. Each growth factor binds to a very specific cell surface receptor, and in turn this modulates the activities of additional messengers. It's just, we're giving the message. It's so neato because what you're doing is you're just reminding the body to heal itself. And, you know, I would say it's a little bit slower when people are older or if they have lots of, you know, problems, diseases. But I've literally had patients that I never saw ever before. They walked in my office, and I did PRP because some doctor sent them to me. And I wasn't treating them for anything else. And they're in their 70s, and they got better. So, you know, I just think it will vary a little bit, like the teenagers, the college students that I've treated, the Olympiads that I've treated. It's amazing, you know, 1 or 2 treatments, and they're just off to the races, so to speak. But, you know, it can take a little bit longer. It depends how much damage is there, how much arthritis you have, how much, you know, erosion of the cartilage you have there. We didn't used to say that this type of therapy would grow cartilage, but there now are studies that show that it actually grows cartilage, and the right kind of cartilage. The sort of the limiting factor is, do you have sort of a scaffolding of some cartilage still sitting there? If all of the cartilage is stripped away and you have a big chunk out of there, you know, I've tried to treat those patients before, and generally it doesn't work because there's just nothing there for the other cartilage cells to hang on to. So, you know, but you know, I always try, you know, prolotherapy and PRP because I've been shocked at some of the cases where there's complete tendon tears and they get better. People that I literally told, I don't think this is going to work, but they begged me to do it, and they got better. So it's always something to try, and it's non-toxic, it's safe. So wound healing and tissue repair. The final tissue, when you get repair of tissue from prolotherapy and PRP, it's literally indistinguishable from the original tissue by any analytical means. They've done studies on this, and they cannot tell, like, is this new tissue or is this the original tissue that was supposed to be there? It looks exactly the same if you compare it to, you know, original tissue. It looks exactly the same. So really, there was an old name for prolotherapy called sclerotherapy, which meant scarring, but that's not what's happening. What you're actually doing is you're sending new cells down to the target tissue, and you're creating new ligament and tendon and cartilage tissue. It ends up stimulating normal growth, not scar tissue. And that's kind of important because when you're looking at ligaments and tendons, you want them to have some give to them. You don't want to, scars are kind of like all mangled and they're hard and they don't move well. These are normal linear functional ligaments and tendons when the treatment has been done and healed. Okay, now people ask me a lot, like, okay, what can I do? Am I going to be down for 6 weeks, you know, after I do this? Everybody kind of has their own sort of recommendations. I've seen doctors say, oh, don't do anything for a month. I think that would depend on how severe, you know, their problem is or their injury is, but for the most part, we are always just telling people 5 to 7 days. For 5 to 7 days, you can walk, you can do light exercise, you can probably even do some light physical therapy, things like that. You just don't want to go out and play basketball. You don't want to go and play volleyball. You don't want to go run a half marathon or a 5K. That's too much stress when we're trying to get the body to heal itself. So movement is good. It's going to increase circulation. It's going to get more of those cells to go down there, but we don't want excessive stress on the joint during the time period that it's going through its inflammatory phase, which is about 100 hours, about 5 days. And then, you know, just kind of for the following, you know, 4 to 6 weeks, we just tell people, okay, gradually get back into activity. Don't do nothing for a week and then go play basketball. You know, test it out. Take a little jog and see how you do with it. And listen to your body. If it's, you know, a little too achy when you do that, just, you know, back off a little bit and just do some walking instead. But our general rule is no heavy activity for 5 to 7 days. And we also tell people no anti-inflammatories, because during that time you don't want to stop the inflammatory process that's telling your body to send new cells down there. So we don't let people do any Advil, ibuprofen, Aleve, Mobic, things like that. You can use Tylenol if necessary. I've only had a couple cases throughout the years. If you really truly need opiates, you can do those for a few days. But we like to recommend natural things. I'll go into some of that in a little bit. But we try to, on the day of the treatment and for a week after, no anti-inflammatories, and no ice either, because ice is an anti-inflammatory. But you can do heat, you can do saunas, you can do topical things that are natural. And now I just want to talk a little bit about hyperbaric oxygen therapy. How can it help repair and reduce pain? And what is it? It's oxygen under pressure. Now we have our new Viteris 32-inch wide, beautiful hyperbaric oxygen chamber. It's in our IV suite, and it's in with our Hocket ozone sauna. But it's a great modality, and it really does reduce pain. I'll tell you a little bit about that later. So let's go into the definition of hyperbaric. Hyper means above or excessive, from the Greek word meaning over, beyond. The Greek word hooper, the Greek root word hooper, meaning over and beyond. So that's the hyper part, above and beyond. And then baric pertains to weight. And here we're really talking about the weight of the pressure of the atmosphere. And so that is where you get the baric part, hyperbaric. So therefore, HBOT is a therapy where oxygen is applied to the patient under pressure, and you have some very amazing effects. Now, let me just tell you something about when the body goes under pressure. So we talk about ATA, which stands for atmosphere absolute. That's the pressure part. So at 1 ATA, that's sea level. So sea level at room air, you have 21% oxygen approximately. And then the oxygen in blood, when that is put under pressure in our low pressure hyperbaric oxygen chamber, you get 0.31 times the oxygen in the blood compared to without the pressure. So it's a 31% increase in oxygen. Okay, so that's if you went in there, just laid in the chamber, you're going to get 31% more oxygen in the blood and in the plasma. If you take that same room air, 1 ATA, 1 atmosphere absolute, and then you add oxygen, you put a mask on the person and they're breathing 100% oxygen, you're going to increase the oxygen in the blood 2 times. That's 200%. And so this is going to give you this arterial oxygen tension measurement at 660, which normally it's just like about 100 when you go in the chamber without any oxygen. So we like people to wear an oxygen mask when they're in there, because they're getting more oxygen, and then more oxygen is under pressure, and then you're getting more oxygen delivered to the tissue. Now in our chamber, you can't see that it's highlighted in yellow here, but our HBOT chambers are about 1.3 ATA. So you're actually getting more than 2 times the amount of oxygen to all your cells, all your organs, all your tissues, your brain, your cerebral spinal fluid, everything. You're getting that much more. And you do feel the pressure when you go under. And it's kind of like you're scuba diving. If you've ever snorkeled or scuba dived and you've gone under, that's why we call it a dive. We call it diving in the chamber. So you go down for your dive and then you come back up. And most people can go down and, within 5 to 10 minutes. If you have sinus problems, like I have a few of those, and I have to be careful when I go in the chamber, it takes me maybe about 12 to 15 minutes to go down and to come back up. You can't just open the chamber in the middle and pop out. Otherwise, it would just feel like something was slamming into your ears. You have to go down, and then when you're done with your session for about an hour, then you have to come back up slowly. And so we have a technician that does that with you, and many people do this at home also. I've had patients that want to do it at home. High pressure HBOT. Now we don't do high pressure hyperbaric oxygen therapy. That's mostly done in hospitals. I do have a few doctor friends that are treating some really critical brain damaged people that had near drowning accidents or severe strokes and things like that. those are going to go down to further pressures like 2 and 3 ATA, and at that point you're getting 500-600% increase in oxygen. But we don't do that here. We're keeping it simple here. Maybe someday we might get a high pressure chamber. But bottom line with all of this is when we supply all that oxygen to all those tissues under pressure, what we're doing is we're super saturating all the body tissues with oxygen. It promotes healing and it reduces inflammation. Like some doctors have said, oh, it's like taking an 800 milligram Motrin. And basically when you think HBOT, think wound healing. That's, the equivalent. There's a guy over in Israel, I'm sorry, I can't remember his name right now, brilliant guy. Over in Israel, they have literally rooms that can house 20, 25 people at a time doing hyperbaric oxygen therapy, and they have nurses in there and everything else. And they do interesting things with the pressure, and they study this stuff. And they did a study showing that people deployed, before their deployment, they took a cognitive test, and they were fine. And then they were deployed. Some of them got blasted by bomb strikes and whatnot. They had those traumatic brain injuries. They came back, they were tested again. Of course, their scores were much poorer because they had had the injury. Then they put them in a hyperbaric oxygen chamber, and they did 40 treatments. And when they were done, their scores were better than before they left. And now they're over there studying it for dementia. They're studying it for brain function. They take college students and test them, challenge them, put them in the chamber, do X amount of treatments, and then retest them again, and they show that their intelligence is better, their accuracy is better. So it really is an amazing treatment. But you can just think HBOT heals wounds, HBOT is anti-inflammatory. I'll tell you another little story. We had a patient recently, I did a consult with him about maybe a month ago. He has an autoimmune disorder. I won't mention his name or anything, of course, but I was so thrilled when he told me he had pretty scary experience. He had to go to the hospital because of his condition. They saved his life, thank goodness. And then he was doing all these alternative therapies to stay healthy and keep it under control. And I said, hey, why don't you just try, 10 hyperbaric oxygen treatments? What can it hurt, And I want to see if it'll help you. So he went in the chamber, and by the second treatment, I think he told me he was like 70 or 80% better by the end of the second treatment. And then he finished out his series of 10 treatments, and he virtually has no pain anymore. He is so impressed that he wants to save up and buy his own machine to do it at home. And we do have a program through Oxy Health that we can refer you to them, and we can set you up with doing it at home if you want to. Usually when we do that, we have you do 2 or 3 of them here so that we make sure that you know how to operate all the equipment, that you can get in and out by yourself and you can handle it all. And then they drop off the machine, help you set it up, get you going, and then you could do 2 treatments a day if you want. When you do it in your home, you have to separate the treatments by 3 hours. But you have it for a month. I think the fee is about $2,500 or so. So it can be done in your home, and we can help set that up for you. So how does it work? It reduces inflammation, as we talked about, reduces swelling, it reduces pain, it promotes tissue healing. HBOT heals wounds. It protects the body by increasing antioxidant production. That oxygen under pressure starts a whole chain reaction of things that gets you to make your own antioxidants, which helps you to fend off things that are damaging or inflammatory, like free radicals and things like that. It produces new blood vessels from scratch. This is no kidding. It's called vasculogenesis. So let's say you're a heart patient and you had a couple heart attacks or something like that. You're stable now though, and you're on your medicines and whatnot and doing all your therapies. If you get in this chamber, you're going to increase the vasculature that supplies your heart. People do that with exercise too, but this is much faster, and then you're getting the anti-inflammatory effects too. It protects the brain. It's a 50% reduction in brain damage following stroke. And they've even done studies that show even like 10, 11 years out, it's better the sooner you get in after you have your stroke. But even 10 to 11 years later, doing hyperbaric oxygen therapy can help somebody recover function get blood flow back to those damaged areas of the brain. Whenever you have a stroke, just remember there's certain cells that do completely die. Now, we're not going to bring those back, but all of the stunned and partially damaged cells that are around that damaged area that won't come back, those can be rejuvenated. Those can be brought back to life. I mean, many, many stories of people doing hyperbaric oxygen therapy for ulcers and wounds in the feet, in diabetics and things like that, and burns, where the area just starts to pink up again. Things like that. At my clinic, I would also combine chelation therapy, because chelation therapy also increases circulation. Also, 5 sessions before surgery have been proven to prevent cognitive decline. Also, in some studies, they do 3 before and 3 after surgery. That's kind of the model that I use, is 3 before and 3 after, because it prepares you for surgery. It prepares you for, the toxic insults of the, anesthesia and things like that. Makes sure you have lots of oxygen in your tissues for healing, because they're creating a little bit of damage there by doing the surgery. And then afterwards, as soon as you can get back up on your feet, get in the chamber, do 3 more. And recently there was a study that came out that showed that 10 sessions reduced post-COVID fatigue significantly. And these 10 sessions were done in a low-pressure hyperbaric oxygen chamber like we have here, and they were done over about a 12-day period, so over 2 weeks. So you're doing them, 3-4 days a week, maybe 5 days a week if possible. Also, hyperbaric oxygen therapy reduces liver damage. So, if you're a person who has fatty liver, or you know that your liver is damaged because you used to drink too much, or you had some kind of a toxic insult or something like that, any damaged tissue, but the liver was studied and it shows that it reduces the damage. And this is another fascinating thing about the hyperbaric oxygen chamber, is it increases your stem cells 800%. And stem cells are your progenitor cells that can become anything in your body. As we age, those become a little bit less. But you can re-stimulate that again by getting in the chamber. So that's why they say it's anti-aging too. Some people will do like the Prolotherapy and the PRP, and then right after they do it, or the day after, they have the person come in and do a hyperbaric oxygen therapy treatment. Do 2 or 3 of them, and it's going to enhance the healing. Some people do that, like we do facial PRP here for, rejuvenating the skin and things like that. You could do hyperbaric oxygen therapy after that for that as well. Okay, now I just wanted to show you some resources. This is Dr. Paul Harch. He wrote a great book that I have read, voraciously, because I love learning about this stuff. It's called The Oxygen Revolution. His website is hbot.com if you want to learn more about it. And he's a fantastic guy. He was one of the guys who basically said, hey, low-pressure hyperbaric oxygen therapy does work. And he did studies showing that it improves post-stroke and post, injury in sports and all of these other things. And he really kind of put low-pressure hyperbaric oxygen therapy like we have at our office on the map. Obviously, like many of his chambers are high pressure because he treats a lot of near-drowning victims and things like that. His website's very interesting. And then there's Dr. Zayed Ratanzi. I took a course from him, and I met him recently at a conference on hyperbaric oxygen therapy. And he has a fantastic website called hyperbaricexperts.com. And there's on the web page that is benefits reported. If you just go to his main website, hyperbaricexperts.com, and you click on benefits, it'll be, I don't know if you can see it here, but there are different systems that, you just click on that system: heart, musculoskeletal, abdominal, GI, immune system, and then it'll give you all the studies and tell you about how it works in those areas of the body. So great information. And I can't not talk about wound healing and nutrition, because that's a lot of what we do here, and I can't emphasize how important it is to take a multivitamin every day. So important. You've got all your cofactors, your minerals, your antioxidants, your just cofactors like B12 and magnesium and zinc and things like that. I mean, we learned how important zinc was these last couple of years. Those are so important in healing. There's other things like sometimes we give people carnitine. Carnitine is very good for healing muscle. Omega-3s are incredible. They reduce inflammation, they heal tissues, they're really good for the brain. So purified fish oils, I mean, the two things that all my patients are on, or they should be on, is a multivitamin and fish oils. And then everything else is kind of designed for, what do they need in their body. I do want to take a second to talk about Ligagenix. Ligagenix is one of my favorite supplements for people who have musculoskeletal pain. Anytime a person is doing prolotherapy or PRP, I usually put people on Ligagenix because it helps to make the protein or the amino acid proline, which makes it's the main ingredient in your connective tissue. And it's a bunch of minerals, but one of the main ingredients in this is stabilized silicon. And this was made by a friend of mine who is an expert in prolotherapy. So that is a great supplement. Usually I put people on Ligagenix 3 per day while they're getting prolotherapy or PRP, and then I put them on 2 a day for maintenance. And it also, by the way, happens to be great for hair, skin, and nails because they're all made from connective tissue also, right? In fact, the nurse for the doctor who makes this product, she had really bad hair loss, and I saw her when she was kind of in the middle of taking this, and she said it was better, and then I saw her 5 years later, and I almost didn't recognize her. It's a slow process, but 3 per day will help anybody with hair loss as well. And I see somebody in the chat wants to know how they can get a copy of the presentation. Just call our office, 616-301-0808. And also my staff will be looking in the chat here. You can always put a message on our Facebook page, but calling the office is great because you can always leave a message and somebody will get back to you, and they'll figure out how to either mail it to you snail mail or figure out if they can email it to you. Okay, so those are my tips on supplements for healing. Vitamin C is huge on healing, anti-inflammatory and healing connective tissue, so we have those vitamin C IVs as well. Now, I try to get people to get off of steroids and non-steroidal anti-inflammatory meds because it's sort of a double-edged sword. All of the non-steroidal anti-inflammatory meds, anything you name, Mobic, ibuprofen, Aleve is the over-the-counter version of naproxen. All of these, yes, they will take away your inflammation and pain, and they might be good for a few days after you have an acute injury, or if you have an acute muscle spasm, that's fine, or if you have a headache. But if you take those chronically all the time, you're going to be reducing cartilage deposition. So, you're replacing your cartilage all the time, right? All your cartilage in all your joints, your knees, your hips, everything. If you're taking a lot of these non-steroidal anti-inflammatories, you're reducing your ability to replace that cartilage, the deposition of cartilage cells. You can look it up on the internet. There's studies since the 80s. But doctors often give them to patients because patients are in pain. But what they don't tell you quite often is that you really shouldn't use these for more than 5 or 10 days, and then you should get off the stuff. Plus, if you take them all the time, you are putting your kidneys at risk, you're putting your gut at risk, you could get a GI bleed, things like that. So, we try not to use too much of them. So then the question is, okay, what else? What do we do instead? So, you can use Tylenol. You don't want to do more than 3,000 milligrams per day. If you have a bad liver, you might even want to do a little bit less. Or if you have to take Tylenol all the time, you want to be on milk thistle, because milk thistle helps to repair and protect the liver. But also we can use ice. We can use alternating heat and ice. We can get compounded various topical creams. I've had gabapentin compounded into a cream because, if any of you out there are on gabapentin or somebody who's been on it for pain, they use it a lot for nerve pain. It's kind of sedating. It makes people tired. People don't like it. They might reserve it for taking it at night so they can sleep better. But it's not great, for the energy levels. So topically, though, you're not going to have the energy problems. You're not going to have the fatigue problems. Also, MSM, these are the more natural things we'll get into. MSM is a great supplement. This is our huge bottle. They don't even make it in the 90 cap anymore, or the 120 capsule anymore. This is 240, because this is an amazing product. It's old, old, old. I mean, it's been around ever since, the last 30 years I've been studying natural medicine. But MSM is dietary sulfur, so it has other effects. It helps to heal your gut. It grabs onto toxins and things like that. It reduces allergies, but mainly this is anti-inflammatory. And this anti-inflammatory effect it has no effect whatsoever on your Prolotherapy or your PRP. So you can take it all the way through, and it has a huge dosing range too. These are 1,000 milligram pills. The minimum dose I tell people to take is 2 twice a day. I've gotten a lot of people off of medications taking 2 twice a day. But you can take up to 2 5 times a day. You don't want to take them all at once, because if you take too much at once, you might get diarrhea. So, I wouldn't take more than probably 3,000 at a time. Some people can tolerate more than others. This is available in a powdered form also. We don't sell it here at our clinic, but you can get it a lot of places in a powdered form if you want to put it in a smoothie or something. And you can open these capsules if you want to too, but MSM, one of my favorites. Also, we've got homeopathics. Now, you can get this many places. Arnica. There's Arnicare. You can get at Walgreens and whatnot. This is a combination. This is not just Arnica, but it's many homeopathics put together in a long-lasting pain relief gel. So we have that. There are oral homeopathics. I'm not a homeopathic expert, but I know those are out there too. Those are things you could try. You can try oral Arnica. That's a nice homeopathic as well. And then we have, this is a product from Orthomolecular. It's a great company. We call it Turmeric Complete. And what it is it's all the different pieces of the turmeric. Like you talk about curcuminoids are the main thing in turmeric that give the anti-inflammatory effect. Well, this is all of the curcuminoids from the whole plant. And there are some studies that show that might work a little bit better than just taking, one fraction of the curcuminoids out, although I've seen some great results with curcumin. So there's that, and then there's also Mariva SF. Mariva SF is a form of curcumin that is made liposomal. So they put in some sunflower lecithin, and when they do this, it gets across the cell membrane better, so it increases the absorption about 5 times. Again, you might respond better to Turmeric Complete. I don't know. You have to try these different things to see. And you can stack these on each other too, like, some people take MSM and turmeric. And we also have another turmeric from Standard Process. Some people really like Standard Process, and they have the best herbal company in the world. Turmeric Forte is another kind of whole turmeric product with some other things in it to make it work better. And then we have Boswellia complex. Now, the Boswellia itself is anti-inflammatory, but this also has a little bit of curcumin in it. So it's kind of a mixed formula. MediHerb is kind of famous for that, but Boswellia complex is another one you could try. These are in tablet form. So if you take these products, they're going to be in tablet form, whereas all the others I've showed you so far are capsules. And then here we have our omega-3s. Like, you can really go up on the dose of these omega-3s. Like, I've had people take as many as 5 to 10,000 milligrams, which is 5 to 10 grams. Normally we say a gram per day is kind of like your maintenance dose for adults. About 600 or so is the maintenance dose for kids. But if you're dealing with pain, you can go up and up and up. Now, these have about 850 per capsule. So if you take 2 of them, that's about 1,600, 1,700. But if you want to go really high, we have, I don't have it here to show you, but we have the liquid high dose Ligagenix, and that is 2,800 per teaspoon. So that makes it really easy. So that's most of our anti-inflammatories that we have here. We also have bioflavonoid complex. I don't use that as much. And then, of course, you've got your daily multi. Now, we have several versions of our daily multis. This is, just we call it daily base. Most people 2 twice a day. If you're really, toxic or you need more work on the body, 3 twice a day. If you're doing some kind of a detox here, we have you take a little bit more. But we also have the Daily Essentials, which is your fish oil and your alpha base, or your daily base. And then it also has some resveratrol in there for your immune system. And it's just a packet twice a day, or some people, if they're doing really well and eating really well, they could just do a packet per day, and that's enough. So, yeah, those are substitutes we can do. Now, I know it's getting close to 7 o'clock, and I know we said we were going to go till 7:30. So I'll just try to whiz through the rest of these. This is just a slide about MSM. And MSM is just fantastic, and it's really, really safe to do while you're doing the prolotherapy or PRP. Now, people ask me how successful is prolotherapy and PRP, and I would say it's about 70%-ish. Sometimes, in some cases, like the younger population, about 90%. Where you get into the 50% range is when you've got somebody with really bad arthritis, or somebody who's got a lot of damage, or somebody who's on a lot of medications, or who's quite a bit older. But heck, I did this on my 94-year-old grandmother when she was still alive. And one treatment of prolotherapy, and she was good to go. She had great knees, though, on her x-ray. But, so you just never know. But, in general, the studies show about 70 to 90% successful. And then there are other studies that show that it's 140% stronger than when it was, originally just normal. And so it basically strengthens the joint and the tissues and protects you from future injury. And it is permanent. It really is permanent. But of course, there is life, okay? We want to jog, we want to walk, we want to ski, we want to ride our bikes. We have little accidents once in a while. So, barring all of that, it is permanent. It does permanently fix the tissue, but it can be re-injured again. So, but it makes it less likely to injure after you've strengthened it. Let's see. Now, this next one, just as a 2012 study, it was 90 adults, painful knee arthritis for at least 3 months. And what they did is they ended up doing the prolotherapy injections. They were done at week 1, week 5, and week 9. And then, as needed, not everybody got these, but some people got treatments at weeks 13 and 17. So depending on how they were doing, they either got 3 or 5 treatments. And the conclusion was that prolotherapy resulted in clinically meaningful, sustained improvement of pain, function, and stiffness scores for knee osteoarthritis compared with blinded saline injections and at-home exercises. So that was how they did it. They compared it to saline. Also, in the Journal of Orthopedic Research and in Connective Tissue Research, these studies showed that there was an increase in ligament and tendon strength up to 40%, and the size also changed with this therapy. And basically it concluded that exercise alone cannot produce these kinds of effects. It was the prolotherapy and PRP injections in these studies. So people ask me a lot, like, okay, can you do this on any area of the body? And I can basically say yes. I've done every area of the body. I've done TMJ joints, occiputs, neck, every part of the spine, hands, wrists, feet, toes, knees, hips, etc. The only thing I don't do, because I don't do it under an ultrasound, I don't have a real-time fluoroscopy, I don't do injections directly into the discs. There are some people that are doing PRP and other stem cells and things like that directly into the discs of the spine, and that's something I would refer you out for. We don't do that here, but basically anything that is causing you a lot of pain, especially with activity, or it's chronic, it's probably going to respond a little or a lot. This is a list of things that might, indicate that PRP, prolotherapy, regenerative injections might help you. Shoulder or hip pain that's causing you trouble sleeping, a joint dislocation or recurrent sprains, joint pain, which is worse with activity and better with rest, or if you like put a kind of a wrap on something or on your back and it's better. Grinding, popping, or clicking in a joint. If muscle relaxants, arthritis medication, cortisone shots don't last. If you do a lot of adjustments and they just don't seem to hold. When surgery's failed, I've done a lot of post-surgical injections. And anything that's kind of helped by a brace, a sling, a splint, kinesiotaping, anything like that, it should respond to prolotherapy. So that gives you an idea. Appropriate candidates. There was a study done once by Hemwall and some other guys, and what they found was the criteria for this therapy to work in patients was an appropriate medical problem. You know, we can't fix a fracture. A desire for recovery in the patient. No underlying medical conditions that would significantly interfere with healing. You know, it's funny, I've done this in rheumatoid arthritis patients and other patients, and they respond less, but they still respond. The only thing I can think of is a really bad case of Ehlers-Danlos syndrome, although I have had some of those respond. But I often just try 2 or 3 treatments on anybody just to see. If it's bone-on-bone arthritis, especially in the hip, I'm probably going to tell people it's not a great idea. Ability and willingness to follow instructions, and the willingness to report progress, and the willingness to receive injections in an effort to recover from injury. Those were the criteria that seemed to end up in people who responded to the treatment. Now, this is me giving injections in a knee to one of my staff members, Linda. And so people ask me, well, how's it done? Does it hurt, you know? Well, I use the smallest needle I can. A lot of my colleagues use large needles, 21 gauge, 22 gauge, 25 gauge. Most of the time, I use a 27 gauge, which is pretty tiny. And, with the PRP, sometimes we have to push a little bit harder to get that out, but it's really not too bad, especially with our Medifuge. The solution's a little bit thinner. In the past, we've had a PRP solution that still had some red blood cells in it, and that was harder to push in. But we really have not had any problem getting it in there with a 27 gauge needle. And so, yeah, it's, we don't really numb it. I do numb the feet often because those are much more touchy. I use a cold spray if people want me to use a cold spray. We have squeezy balls and things like that. We get people through it however we have to. Some people request the anesthesia, but it is just another set of injections. So these are just showing the ligaments of the spine. I know you can't see it very well, but if you're looking at this all along here, all up and down the spine, there's a ligament that goes, it's called the supraspinous ligament. And then out here between each vertebrae on both sides are the intertransversarii ligaments. And then down here you have the deep sacroiliac ligaments. And then from the side you can kind of see those here too, the deep sacroiliac ligaments. So that's just to show you how many ligaments are there in the lumbosacral area. And then this one again, I think you can see it there a little bit, but you can see you've got this superficial layer of sacroiliac ligaments, and then you have the deeper layer, and then you also have these iliolumbar ligaments here. These are the major stabilizers of your low back. Those are very important, so we inject those along here, 3 or 4 shots on each side, and 2 or 3 shots, mostly 3 shots on each side here, and then we're going to do these layers on the supraspinous ligament. And if we feel a level is really unstable, we'll go to these intertransversarii ligaments, but we're really not getting down to the level of the disc or the spinal cord, just so you know. And myself and Christy Taylor, my PA, we are the ones that do it, and we've gotten a good feel for it over the years. We've never had any major problems. This just shows you a picture of the ligaments of the shoulder. This picture is trying to show, I don't think you can see it there, but it's showing ligaments that are frayed and not healthy. And then after prolotherapy, see if these pictures show up here now. Oh, good. It looks like you can see it. This is a picture of somebody who has a torn Achilles tendon. You can see where the arrow is here. There's definitely, it's dark and dark up above, but there's a space right there. So that is a torn Achilles ligament. And we're talking almost completely torn. There's maybe a few shreds of tendon there. And so this is afterwards, it's completely normal. You can see a little modeling there, like it's different than the other tissue, but it is solid now. I'll show you those right next to each other. And hopefully you can see that. It's hard to see there, but before, there's a hole there, and after, it's filled in. And I think this person had two treatments, I think it was. I can't remember exactly, but not that many. It was with PRP. Now the next slide. This is a patellar tendonitis. So what they're showing you here is, this would be like the kneecap here. And this patellar tendon comes down and attaches there, and it's irregular. You can see that. Compared to down here, see this nice arc? That's an attachment of the patellar tendon that's totally normal. So this was the left knee that had the abnormality, and this was the right knee that was normal. And this is really amazing. This is non-surgically repaired with PRP after 2 injections. This is 16 weeks, just 16 weeks after the second injection. It went from this to this. Now remember, before, this is what the right knee looked like. This is what the left knee looks like now, totally normal. And it came from this, just by doing PRP, 2 sets of injections. Now, this is a total knee replacement, a PRP and total knee replacement. And what they did is, even though these people had their knees replaced in this study, they did PRP in the surrounding ligaments. And what it showed was that they had earlier function and range of motion. They had shorter length of stay in the hospital. They had decreased IV and oral narcotics. That's great. And then lower drop in post-op hemoglobin. So they bled less, after their surgery. And this is total knee replacement. You would think, why are you doing this? You get a new total knee, but you have to cut the surfaces of the joint, right? And so you're injecting this in there to help it repair. Now, this is one of my cases. I had a thoracic spine ligament tear in a young gymnast. She was only 10 years old. I think she was one of my youngest patients for PRP. Came over from Detroit, was sent to me from MSU Sports Medicine. And her pain was so bad that she had to be on Paxil, which is it's an antidepressant, anti-anxietal medication. And I would do anything to get this child off this medication, because I just don't think that's good for your brain and your nervous system to be on that for a lifetime. But it was still causing her considerable anxiety because of the pain. So, and she was a little toughie. She was great. She came in once a month. We did 3 treatments in this T3-4 area. I actually have the MRI to show this. I need to take pictures of that sometime and put it in this lecture, but it was completely healed. It was torn, and then it was completely healed after we did these 3 treatments. And she totally got off the medication. She was totally pain-free. And so now this person has a lifetime of health and wellness instead of medication dependency. This is another case of mine. I had a triceps tendon tear. This fellow was a 68-year-old retired policeman. He liked to work out. He liked to stay in shape. And he tore his insertional fibers of his triceps tendon down here, where it inserts on the elbow, the olecranon process. And they were ready to do surgery. Like, he was scheduled. He was going to go have this repaired. And a friend of his who had done prolotherapy, PRP in her shoulder, she said, why don't you go see Dr. Auburn and see what she can do? And so I was like, hey, I don't know. There's a complete tear there. There's maybe still a few fibers there. They've had documented improvements in people such as your case, so let's try it. So we ended up doing 4 PRPs over about a 4 to 5 month span, and he was pain-free. He was able to go back to weightlifting. He did not have to have surgery. He did not need pain medication. So that's one of my great successes with PRP. So yeah, remember, as I said earlier, these ligaments and tendons are going to be stronger than the untreated ligament, tendon, or joint. They provide more support, stability, lowers the potential future injury. And C. Everett Koop, some of you who are my age in the late 50s might remember C. Everett Koop. He was the former U.S. general surgeon. He had really, really bad low back pain, and he thought it was just chronic, disabling. He was going to have to live with it forever. And he found out about prolotherapy, and I don't even think PRP was popular back then or not used that much. And his quote was, "My intractable pain was not intractable." So it really did help him. So now where does ozone fit into all this? We talked about ozone earlier. There's a prolozone technique where we do the injections of the Prolo or PRP, and then after that we follow that with injections of ozone gas. And that's basically all there is to it, and it enhances the healing. So what is ozone? Some of you that come to the practice, you might know what ozone is, but for those of you that don't, ozone is O3. You know, like oxygen is O2, ozone is O3. It's colorless, it's very unstable, it's very active, potentially toxic. Like, you don't want to breathe the stuff in, but you can inject it into lots of different things. We do something called major autohemotherapy, where we take blood from the person, put it in saline in an IV, put the ozone in there, and then infuse it back in them, and it has amazing properties. But it differs from oxygen because it's got 3 atoms, not 2. And it has activity against all of these pathogens. So we're not really doing that as part of the musculoskeletal injections, but you know, it's anti almost every pathogen you can think of. And okay, so how is it created? This is a picture of a mad scientist. That's Dr. Auburn making her ozone. Basically, the little diagram here shows that what you do is you hook up oxygen to this generator, this ozone generator. The oxygen goes in there, and there's a controlled spark that hits the oxygen. Depending on how fast the spark is and how fast the flow of oxygen is, then you make more ozone, because what it does is it splits apart the oxygen into singlet oxygen and then brings it back together as triplet oxygen. And when you're all done, only 3% of it is ozone, but it's enough to have these amazing effects. And so it's very reactive. It's used in, you know, air purification, water purification, but we can use it for lots of medical therapies. In healthy cells, you have something called mitochondria. You have 2,000 mitochondria that are making your ATP, your energy for your cells all the time. They help the cell function normally. As we get older, we have less of those. And so when you put ozone into an area, you get those mitochondria to function better, to heal the body better, to get rid of toxins better, to reduce inflammation better, to take in nutrients better, et cetera, et cetera. So you increase all those things, and you increase your utilization of oxygen. Like, it's not the same as if I put a mask of oxygen on and I was breathing pure oxygen. Okay, yeah, you'll get a little bit more oxygen, but are you using that at your tissues? Well, with ozone, it increases the utilization of oxygen at your tissues. It also does this thing kind of like the hyperbaric oxygen chamber I was talking about earlier. It increases your production of antioxidant enzymes. And that has an anti-inflammatory effect and a healing effect. Now, what does it do to pathologic cells, like bacteria or viruses? Well, because they don't have the antioxidant enzymes that your normal cells do, it will break down the walls of those cells, and it will get rid of them. It'll destroy them. It'll just break them apart. So prolozone, what is prolozone? That is, you give the Prolo, and then you follow that with ozone injections. And it basically can be, when you do prolozone, it often is not just the sugar solution that we use for Prolo and the anesthetic and the homeopathic, but sometimes you put a drop of steroid in there, sometimes you put B vitamins in there, some people put vitamin C in there, homeopathics, things like that. And the glucose supplies the mitochondrial substrate. The B vitamins improve glucose utilization at the tissue, and the ozone stimulates circulation, oxygen utilization, and tissue repair. So they kind of just go, hand in glove. They work really well to enhance the healing. for any PRP or prolotherapy we do per area, we just charge $75 for the ozone, to adding the ozone. It's very simple, very quick. And then this is a study where it was done at University of Texas Medical Branch by Oncogene, and they showed that peroxides, which is something that's produced by ozone, stimulates growth factors. So it's a determinant in the cellular processes like proliferation, differentiation, making new tissue, repairing tissue. And their conclusion was, we have recently reported that hydrogen peroxide, an active oxygen species and a cellular antioxidant, stimulates growth response events in vascular smooth muscle cells. Our findings show that hydrogen peroxide stimulates tyrosine phosphorylation of several proteins, including epidermal growth factor receptor. So again, what that all means is it produces repair of tissue. So when you do prolozone, you're resulting in the tissue stem cells and blast cells in the target tissue so that they get what they need. And the circulation and the membrane stability are reestablished. Pain is reduced. Actually, ozone is quite the analgesic. And ozone complements both prolotherapy and PRP. I suppose you could use it with stem cells too. We're not doing stem cells here right now because of the current FDA rulings, but hopefully we can get that back someday. But I have a patient, her initials are MM. She was 72 years old. She had acute osteoarthritis and rheumatoid arthritis. So this is a case of somebody who has an autoimmune disorder, but yet they are responding to PRP with ozone. In her statement, she says, the osteoarthritis has affected my knees to the extent that walking and climbing stairs was becoming very difficult. I had tried a series of shots and ointments with little relief. It was through my physical therapist, Scott Benjamin, that I met Dr. Auburn. We talked, and she went over my reports and asked if I would be open to trying PRP with ozone. Not wanting to have surgery, I thought, why not go for it? So I did. What a difference. I now can do stairs with no pain. I will admit the knees were sore after the shots for a few days, but I would do it again. I am very happy with my results. So these are just, typical stories we hear all the time. We do have our few cases of severe arthritis that maybe don't respond as well, but this is a typical response to prolotherapy and PRP and ozone. So if you want us silly St. Patrick's Day crazy people to do your injections, this is a picture of me, Dr. Auburn, and Christy being goofballs here. We have a lot of fun at the clinic. Any of our providers can assess you for pain and can do a lot of things to treat your pain and can prescribe, the hyperbaric oxygen therapy, the Hocket ozone sauna, things like that. But Christy and I are the ones that do the injections. So if they send you over to us, we'll do the injections. But anybody can do your intake and your analysis and decide if you're a candidate. So I do have some further case studies and other information, but I don't think I'll go into those tonight because we've covered a lot of ground. I didn't talk much about our Hocket sauna. Our Hocket sauna is an ozone sauna. It's also got far infrared. We do aromatherapy with essential oils. There's also an electrotherapy in the chamber, and there's also steam. And I myself, when I had shoulder tendonitis, would go in there, and when I'd come out, my pain was gone for days. I still got some prolotherapy because I knew there was damage there. I know how all that stuff works. So I think I ended up getting about 3 prolotherapy injections and doing about 10 of the Hocket saunas. And my shoulders are totally fine now. Now I'm probably not going to do a lot of push-ups because the way I got it, the problem was doing push-up challenge with my brother-in-law. When I do push-ups, I just do them standing up against a cupboard like this. I don't do on the floor push-ups anymore because I know that, I'm one of those susceptible people. And, when you're over 50, push-ups are not the greatest idea because you can really damage those tendons. So, but fully recovered. I can do anything now. I can play sports. I can jog. I can exercise. I can lift weights. So I'm a case study in itself. So, but if you do have any questions, we'll look through the chat here and see if we can answer anything for you. And please, if you do have any questions, feel free to check out our website, nhicwestmi.com. That's nhicwestmi.com. We have tons of information on there. There's lots of articles on there about anything you can imagine. And, message us, call us, 616-301-0808. We are very busy, and I'm sorry if we don't pick up the phone when you call. I wish I could fix that problem, but please leave a message. We're really, really good at getting back to people within hours, if not maximum like 24 hours. But we do want to help you. We love helping people. We love caring for people. We love to see the smiles on people's faces as they get better. And if you are in chronic pain, even if you have tried the PRP and the Prolo before and it didn't work for you, you really should consider the hyperbaric oxygen chamber. It really is something for chronic pain that shows fantastic promise. You can try it out here, and then maybe it is something you want to do in your own home if you do have chronic pain, and we can help you figure out how to do that. Thank you very much for listening. I won't hold you anymore tonight. It was a pleasure. And I look forward to seeing you again at our next patient education night. I think that's in a couple of months. We'll be announcing it, and it is on our website too. I can't remember what it is right now, but I will be talking to you again. Take care. Bye now.